Okay, there we go. How are we going, people? I believe we've gone live. It's 8:03, and this is the Sports Therapy Association, episode 49. I'm just going to wait until some people start joining us live on Facebook, just to make sure it has worked. If you're listening to the recording, that's fantastic. If you think the time as to leave a review and a rating, that'd be great. But of course, as always, we encourage you to come and join us live if you're free, if you've got nothing better to do on a Tuesday at 8 o'clock. People are joining us live as we speak. So Gary Benson, founder of STA, is in the house. Hey, Gary. Hey, Chris. Hey, Brian. Hey, Becky. And if you do join us live, of course, then we can bring you up on the screen with your Facebook profile and whatever you're saying. And tonight in particular, we really want you to ask questions, or every evening, every week we do, but tonight it's really all about you guys to fuel us with your questions. And hey, Stevie as well. So before we kick into tonight, then thank you very much to everybody who has left reviews particularly on Apple Podcasts. It does make a huge difference. YouTube is great as well, but if you really want to help us, then Sports Therapy Association podcast on Apple. So if you've got an iPhone, it takes a few seconds, because I think you just go to the app and then you can go to the rating and just chuck 5 stars there. Fantastic. Leave a nice review if you want to let other people know what you thought about it. And that'd be great. It makes a big difference in us just appearing in Google results. It's not to make money or anything, it's just so we can reach more people. We get fantastic guests. It's really nice to let people know that we're getting these guests. So if you could do that, that'd be great. Talking of fantastic guests, last week we had the very esteemed and respected Dr. Mark Laslett with us, explaining the difference between sacroiliac joint dysfunction and sacroiliac joint pain. And it's a great area. It's a dangerous area because straight away, without much of a warm-up or pillow talk, it kind of gets rid of a lot of what's still taught on courses with regards to things like the Stork test and the Gillett test and sacroiliac joint dysfunction. It's moving too much, it's moving too little, palpation, relying on palpation to actually make an assumption about how the person's pelvis is sitting or whether it's opening and closing properly. Lots and lots of stuff to make you go, huh? But I've just paid £3,000 for a course and it was all about that. Sorry about that, but don't worry, my message afterwards and with a few posts was, it doesn't mean you're throwing everything away at all. Far from it. Okay, it's not about that. It's about making little changes and just changing the weight that you give to certain things. You've got the most amazing tool anybody who is a sports therapist or sports massage therapist has got is the fact that you want to help people. Not everyone wants that. Some people just want to sit in an office and press keys and make things balance and just enjoy the money after and go on holiday. But you guys actually want to work for not much money and just have thank you from everybody at the end of the day and improve people's lives and health. That's fantastic. So at no point are we kind of attacking and taking things away from you thinking, well, what you got left? Nothing. Totally the opposite. It's all about helping you change the balance of maybe things you've learned as a foundation and then just kind of tweaking it. Did you know if this isn't so important, maybe you should practice this or do some CPD in this? That's all. But anyway, it's there on as a podcast and on YouTube if you want to listen to it. Really is a master of the game, so many years of experience and papers. It was a real pleasure to have Dr. Mark in the house, so thank you very much for that. Right, and if you do want to go to the website, then Mark Laslett, look that up, and there's plenty of details on courses you can do. The first level course is ideal for somebody who is an undergraduate and wants to just brush up and some kind of evolve with regards to things like sacroiliac joints and indeed across the whole lower back. Is producing fantastic papers and information for us. Okay, as you saw now, what I'm going to do at the beginning of the month is produce all the guests coming up. So I think that's quite a good idea. I should have done it probably 49 episodes ago, but you can see what's happening this May. So this week we have what I'm hoping will be a really productive and empowering discussion with 3 fantastic guests, all from slightly different backgrounds, which is really cool. And I did that on purpose. So hopefully we'll have a great discussion, but you guys as well, bring in those questions. Also next week, we've got Gerard Green with a pelvic health special. Very excited about that. Anybody who follows Gerard Green will know how respected he is in that world. It's going to be great to have him in the house as well. And then the week after, we have Rachel Zoffness, which is going to be an astoundingly good episode. She's highly respected author of a pain management book and looking at the psychology of pain. It's going to be really, really interesting. She's a lovely speaker, a really nice person. I encourage you all to put that in your diary. And then we'll have the long-awaited insurance special with David Ballance. okay, to fire your questions about insurance. And that will be, at the end of May. So hopefully a great month coming up. Do try and join us live if you're listening to the podcast or watching the YouTube video later on, because whatever guest we get is all directed by you guys, asking comments, questions, and all that sort of stuff. So, right, so that's said and done. What have we got for you tonight? Well, we've got how much do words matter? It's going to be, I'm really looking forward to it. It's going to be, I've got some lovely people coming up to join us. We've got Matt Scarsbrook from the Massage Collective. We've got Frances Thomson, who many of you might already know, but when it comes to biomechanics and biomechanics education, Rachel's been in the game for a long time and evolved fantastically. And I'm really looking forward to having her talk about this. And also we have Benjamin Mace-Crossley, who's some of you will know him as the STA rep for Chester, Wirral, and kind of all that Manc area. And also he's got his Repose Sports Massage and Injury Clinic. So fantastic collection of people. You may have seen the advert change slightly on social media. It's not actually going to be an ABBA revival tonight. Thanks, Ben, for mocking that up. I'm sorry if that caused confusion. It is Do Words Matter is not a new kind of song released by ABBA. It is actually us. It was just a coincidence that came along. So it's not going to be that. If that's confusion, I'll apologise for that. It's actually going to be, as published, Do Words Matter. If you'd like T-shirts with that, I think they're being printed as we make. So just send an email to matt@sta.co.uk. Right, or mug maybe. Okay, so let's get rid of this and start bringing up the people that matter. I'm going to get rid of the pictures in no particular order. Let's bring them up. One. Hey, Ben.
Hey up.
How you doing? Hey up. There we are.
The Yorkshire coming out.
There we are. And Matt's here as well. How you doing, mate?
I'm all right. How are you?
And then let's bring up Rachel. Then we're here. Knowing me, knowing you. How are you?
Yeah, good. Thanks.
Excellent. Right. So I've just, as I was blabbering on, I've ignored the people actually in the house here saying hello. So we'll just have a few more hellos to people here. Hey, Julia, how you doing? Hope you're well as well. Alistair Cunningham is here as well. Daniel Alexander, familiar faces. Fantastic. You've pulled out the best. Gary is quoting Mike Grice, which can never be a bad thing. Here we go. To reference the great Mike Grice, no one is questioning what you're doing. Instead, think about how you explain what you're doing. Beautiful. There we go. Scott Loynes is here as well. Hey, Scott, how you doing? Scott hosts the podcast Extra with regional reps and things. So if you're not following Scott, then make sure you do. Some fantastic information coming out on those. Becky's really excited about Rachel's office. Yeah, me too. I had a chat with a fantastic person. Really nice. Now and again, you meet people in your lives which just kind of exude kind of interest, and she was in San Francisco at the time, so it was great. Chris Kitson says, "What is Chris? So dysfunctional, Dan." I'm not sure what Chris was going on about. And Alistair, hey, sorry, Chris, that was very dismissive. Nice to see you, Kitson. And Becky DeMott Horton, the best half of the Massage Collective, the one I tune in to listen to, is in the house as well. Hey, Becky, how are you? Thanks for joining us. And Mike's here as well. Right, we've got a great show. Okay, thank you, people. Remember, if you've got questions for anybody, just chuck them in. We will all keep an eye on what's going on in the comments. So just ask when, and we will get to you, okay? Right, let's get rid of that. Okay, gang, so here we are. Why do words, or do words, what's the title we chose? How much do words matter? So have we assumed that words do matter then? I mean, the title was really tricky. If we say how much do words matter, we all agree that words do matter.
Yeah.
I mean, we could probably wrap this up immediately with the classic term, it depends.
Okay. Yeah. Thank you very much for joining us. We'll be back next week with Gerald Green. My first question, and I want this to kind of flow according to people asking questions, but why are we here having this conversation? And you can ask, whoever wants to answer that.
Shall I go for it? Yeah, go on, I'll go for it. So for me, what I've seen a lot on social media, and it's no sort of bashing for the people saying it in that sense, it's more kind of just bringing a light to the fact of, you know, most of the sort of heads, if you want, or, you know, the sort of head leads of the social and the soft tissue side of things that we're seeing, they're sort of bashing the terminologies that we use as layman terms coming in from a more, you know, undergraduate and kind of brand new to the, you know, the profession. So yeah, so I guess what I'm trying to say is, so you know, you guys can speak about it to yourselves in your sort of tongue and your language, and especially with your further education, that makes sense to you. And then to us guys and to, you know, the general public, we speak to it in a more layman terms because it's what we know and it's what we taught. Now, that doesn't change the fact of really what we're kind of doing with our hands, you know, unless you're really thumping someone or you've just been taught or whatever, then the kind of the techniques that we're sort of using anyway doesn't change. So therefore the outcome doesn't particularly change. So me saying, you know, Debbie from the Chippy calls in and she's saying, I've got loads of knots in my shoulders. I come here, let's get those knots out for you. And I'm speaking to her and I'm saying, oh, come on, let's get those knots out. We've massaged the area, you know, we've done a couple of whatever we've done, whatever techniques we've used. She's left understanding that that feels better and I've got those knots out. It doesn't matter what those knots are in technical and academic words. It's what that person thinks, what the client thinks it is, and how you're relating to that client and what they leave. You know, do they feel good with what you've done afterwards, and do they believe that you've got out of them what they've come to see you for? Does that make sense?
That's
Did I word that right? Yeah,
I think it's great. I think it's spoken for an awful lot of people. And so if that makes sense to you guys listening in the house, then make sure you kind of back that up or agree, or you can start disagreeing, whatever you want to do.
Yeah, if I disagree.
Yeah,
of course. Yeah.
Talking of disagreement.
Yeah.
Talking of disagreement. So probably the first place that, I mean, for me, and this actually comes out of a conversation that I was having with Dan Alexander earlier, was that it probably helps to have a bit of a definition of what we mean by layman's terms, and to understand that taking a complex idea and making it less complex, i.e. putting it into layman's terms, does not necessarily or shouldn't involve changing the meaning behind that terminology and those words. And I think this is possibly where there's a little bit of confusion between what a layman's term is and what, you know, is the kind of correct academic way of looking at it, if, you know, to use your terminology there, Benjamin. And I think, I mean, to sort of speak to your point about knots, it may be that if an individual comes in and literally all they're identifying with is they have knots that occur, and they find that a massage or some form of manual therapy helps remove them, then that's absolutely fine. But what we do know is that for people who have a little bit more complexity or for pain that's persistent, we know that what they believe changes their pain. So because what we know is if pain is if pain is an expression of the nervous system, shall we say, or you know, of the brain, when on balance it decides it's in danger, beliefs and thoughts are also nervous system impulses, and so we know that informs how they respond to pain. So for someone for whom it's I know I've overdone it at the gym and I just need a good rub, then that term, and Anna Maria will shoot me for using that term, then absolutely I think I would agree with you, kind of what's the harm. But I think the problem is that because we don't know, or very, very rarely do we know quickly all of that detail, we do need to be mindful about what we're reinforcing, or what beliefs that client has that we're reinforcing with our language, or that we're trying to move them slowly towards. So for example, with the knots, you might say, you know, this feels good to you, but you might not want to specifically say that you do feel anything or don't feel anything, because we know that actually very rarely can we actually identify knots in someone's muscles. And also it depends what they mean by a knot. Do they think that a knot is literally the tissue has twisted on itself? Do you see what I mean?
Yeah, absolutely. Yeah, and I get that. And you get people coming in who, you know, I've had a few runners on the table who they'll say, "Oh, my calves are completely and utterly full of knots." You know, how can your calf be completely full of knots? And you run, and it's like, "Oh, can you feel them underneath?" And you kind of touch, and you're like, "Not really, no." But if it makes you feel better, then yeah, and I'm getting them all out. I'm kind of, you know, rubbing up, and all I'm doing is, as you say, we're stimulating the nervous system around the area, and it's causing the stress and discomfort of the area to relax the tissue around it, and therefore the pain tends to go away. And we get that, we understand that, but trying to explain that to somebody who maybe they don't even care to understand it on such a level, you know, like, yeah. So what is a knot? So,
well, yes,
you know,
I guess
you know,
say
we could say a knot is, you know, on a kind of how it was explained as a trigger point within an adhesion within a muscle fiber, within the myosin of a muscle fiber. Like if you start saying words like that to somebody, you know, who are just not that not turned on, but you know, that mentally switched on with that, you kind of lose them. It's almost jargon. You know, if someone comes to you and starts talking to you about, I don't know how switched on you are with electronics in the back of the telly. I don't have a clue what's making my telly work. I know I just want a high definition telly, you know, with Freeview or something like that built in. And as long as they're saying it's got that in, sure, I'll pay for it. It's fine. It's done. So it's really, it's what are they coming to you for, and can you give them the relief they want? And if it's by saying to, okay, so another one, let's make up another character. So Big Dave, rugby player, he wants someone to dig into his muscles. Yeah, I'll dig in, Dave. It's just what he wants, and we know like it doesn't have to be as heavy-handed as what some people want. Some people prefer a light touch, some people prefer a heavy touch, and it's, you know, it's, and some people will stop going to a client, to a therapist, if they're too light or too heavy, because it depends on what they feel and what they like. And it's the same with that terminology. Like you could go to someone, they could start talking about, you know, even if it's, you know, they're talking about in maybe a Swedish massage sort of sense, and they're using long strokes terminology and soft strokes and this, that, and the other, and they're not really talking to you about your the actual muscle groups involved. Where if you're a sports person, you kind of want a little bit more of the muscle groups involved. But then this same person who's coming to see you because they've heard you're a good masseuse, who's not interested in knowing what the muscle groups are involved, they just want a bit more of a massage from someone who they've heard's really good, but they're coming to you just to understand that you're going to make them feel better to get the knots out. So what's wrong with saying that?
Well, I suppose, you know, picking up on Stevie Barr's point, a few moments ago, you explained that you were, you know, when you were hands-on with that calf that was full of knots, that you were, you know, interacting with the nervous system, calming things down, and essentially helping release whatever tension is.
Yeah. So we understand what it is. Yeah.
Why is that not layman's terms? Because you could give that explanation, and you haven't mentioned the word knot.
Because they've come to you explaining that and wanting you to get those knots out. So yeah, I mean, you could, Steve, you're right. You know, we could say it in that sense and kind of bring their head back around, but then that person could leave feeling that they've not been listened to because you're now speaking to them in a way that doesn't make sense to them.
And
Right, what is Rachel in? Yeah, Rachel. Rachel,
Yeah.
they're nodding, shaking, and nodding. I want to hear
Yeah.
Clearly, words are really important, and we all know that because that's how we communicate, and we've all felt the difference being online instead of face-to-face. Communication is not just through words, it's through facial expression, it's through contact, it's through sound, intonation, and I think there's a lot of evidence that everybody's talking about around use of words and recovery and pain and everything else, and that's out there, but there's no library that teaches us from a young age how to interpret words within our own context. There's a lot of cognitive bias to the use of language, and so where one will perceive it, to Ben's point, as, yeah, I want you to rub a knot out, Ben says, yeah, okay, I've rubbed your knot out, they feel better, and that's great. And then you have another client, you use that language and there's a detrimental effect. So there's no library of do and don't use. Matt's highlighting the idea that there's your technical language and then your lay language, but again, there's no list of lay language. What is that? So there's always going to be arguments on both sides, and I think that's down to the therapist in their soft skills to be able to develop the relationship. I think Dan talked about it earlier. You have to develop a relationship. You have to understand the client, and you forge that relationship over time. and then develop a language that creates the dynamic between you.
Yeah,
it's that drip feed effect, isn't it, that Dan was mentioning. And I think, you know, I'm not saying use technical jargon with your client at all, but what I am saying is be cautious about what you think is a translation to layman's terms, and whether the actual I'm going to use it air quotes here, the truth behind the statement you're making has been altered somewhat. I'm trying to think of an example. I don't know. I mean, what I think the thing that we need to avoid is which is perhaps where some of the sort of myth busting and debunking and all those fairly strong words are kind of coming into the conversation, is that we need to be cautious that we're not implying that we are doing things to the client that we are not doing, because that comes with it potentially an inherent message that you are so
it's hard, isn't it?
lacking robustness, which means that me with my hands can physically change who you are and what you are, and I can move all this stuff around, and these toxins that I'm pushing around your body you should be really worried about. And you know,
that isn't just the language, is it though, Matt? That isn't just the words they're using. That could be the whole context, the way it's imparted, because
that's the way it's taught, Rachel.
But if you have a trust from a client, if they trust you and they believe in you, whatever you're saying, then that is going to have more of a beneficial effect to them feeling better with a hands-on approach or exercise or whatever it is you do. If they don't trust you, if they're a bit unsure, then you could even use the same words, but the relationship between you, which is forged, yes, through words, could be forged differently with one client to another, using exactly the same vocabulary, to Ben's point, about your training and your background. So it's a really tricky one. And I actually feel for all the learners and educators, I find it really difficult to choose the right words when I'm teaching people coming in at base level. And this was another point I wanted to make, if I may, just to flip this round, professional to professional, which is, I think, where this whole conversation came from.
Yeah.
And the keyboard warriors who, you know, really have a go at new learners who are inexperienced at techie speak, you know, exactly what's happening. When you're a level 2 gym instructor, you don't understand the concept of 3 or 4. Same with massage. You know, you have to go through a level of comprehension, getting it wrong. It doesn't work with that client. Right, I need to change what I've done. That didn't seem to work. So I think there's a comprehension layer as well that we need to appreciate, that it's just got to come over time.
Is that, do you think that's a symptom almost of the fact that within health and fitness, and you know, you mentioned PTs, and I think it's a relevant point, because there is such crossover, particularly when we're talking about pain and injury, which is generally what we're talking about here. Do you think it comes from we deliver, or we have traditionally delivered a recipe approach to treating people, and for when those students first come across the idea that actually there is no recipe, it's entirely individual, and it sort of doesn't really matter what you do, provided you're doing it in partnership with the person in front of you, with the client, then almost that freedom seems really scary and terrifying, because they were expecting to be able to follow a bit of a formula when they came. And if that is part of it, does that not fall back to the education side of things, to actually themselves, the educators, to be confident in teaching outside of a formulaic approach? I
think Mike's just nailed it, actually. Mike's just said, I think sometimes we find it difficult to say to clients, we don't know why things work the way they do, it just may help. I think that's the same from an education perspective. And I just want to quote Mike Stewart, not verbatim, by the way, but Mike Stewart did a podcast a few weeks ago, and he's got a degree in education, and he talked about 4 layers of learning. And in the beginning, you're very black and white and dualist. And what you need is you've got quads and you've got hamstrings, and that's almost it. And not that literally, Matt, don't have a go at me there. But conceptually, you need a bit of black and white because you don't have the experience and the depth of knowledge yet. Then you go on to a level 3 or the next level, and your comprehension starts to develop. And he talked about a confusion state, which is when you've learned a different concept and there's 5 quads and there might even be a 6. And then you go, what's going on here? My education was rubbish. Well, it's not. It's just going through the layers of comprehension until you get to layer 4, where he talked about you fit into a level of comfort in knowing what you do know, but also what you don't know. And you're really open to doing that, which is what Mike Grice has just stated there.
And I suppose then, should the level 2... Okay, so if we're equating the levels then to the levels of education as well.
Just as an example.
No, but it's a great example. I mean, I tend to use an example of, so I ended up studying chemistry from GCSE through to degree, and the concept of what is an atom. You're taught at GCSE level it's basically a ball with other balls flying around it. You know, that classic kind of Big Bang Theory type styling. And then you end up going into A level, and you discover that a ball isn't really ball shaped, and those things spinning around it, it's more like a vague cloud. And then you end up going up into degree level, and it's like, yeah, that's all bollocks. But all the way through, you're kind of prepped to know that what you're being taught is relevant now, but it is not the final answer. And I wonder if that's missing in some of the levels of education within our industry, is that I'm teaching you what you need to know now, because exactly to your point, we need a framework. You need a structure to be able to hang things on in order to just simply recall. I mean, it's not just recall your anatomy, right? But we need to perhaps prepare people for the fact that the truth is bigger than that, but this is enough for right now. And that if you continue your studies, you will discover this stuff, as opposed to perhaps what we're kind of experiencing in some areas now, is that people have gone all the way through to, say, even their level 5, and you know, they've been practicing for 10, 15 years, and then they're suddenly being told what they think is debunked or totally wrong or thrown out.
And I think this is when you compare this type of education against degree level, which is again the conversation I've had with Ben about. We're now doing it in stages, whereas if you're in a degree, you're going through that over that period of time, straight through from your level 1, whatever you call it, up to level 5, whatever you want to call it, to degree level. What our industry, both therapy and movement industries, have done has created a fast path. The problem is, the point you're making, Matt, we haven't quite worked out, maybe, how best to prepare them for that end level, because it's developed over time while still being put out there, and so maybe nobody's challenged it like we are doing now. And I think you're right. I think educators should listen and think more about maybe how that pathway is developed. Maybe, I don't know. But we want cheaper and quicker, don't we, access to courses? So
can we just, for people who are joining us on the podcast, and I mean, I always like remembering that we could have somebody who's joining, I hope we have someone who's joining us who has just done their level 3 or maybe even 4, depending who they've done it with, and they're kind of like, oh, I've heard on Twitter, I've seen somewhere that people are saying that all I've done is crap, and I've heard that here the message gets put out gently, and they're not just going to kind of make me feel really bad and stuff. But can we just summarize? We've kind of touched onto it, but what is the potential harm, and how backed is it, if you guys know by the evidence, of letting the client believe that you are ironing out a knot or realigning their body or making their shoulders the same length? Or what is the potential damage, and should we be telling all therapists about that damage regardless of level? Do we all agree that there is some danger in kind of this kind of structural basis?
I think, and I'm slightly anxious to give this one, and I have to shout out to Mike for finding this paper for me, which was by Darlow, I think it's 2013, and it was a study into the enduring impact of what clinicians say to people with low back pain. So I was trying to look at the evidence behind language, and I don't want to put any fear-mongering on anybody, that's not my point. However, to just answer your question, Matt, this was the response of one of the people in the study. She'd been tested by various physios and Pilates teachers, told she's apparently got a ridiculously weak core, so she had an abortion. So the power of words not being communicated appropriately, that to us sounds almost so extreme, but for that individual having a weak core, she felt she couldn't handle having and carrying a baby. So that's profound. That's the extreme end. So
yeah. That is extreme, isn't it?
Put it back to something a bit more light-hearted, but I thought that was fascinating.
So yeah, I mean, that is absolutely fascinating, and you're right, that is a complete extreme end. And I mean, and again, it comes back to the actual context of that individual and that client in front of you right there and then. So Matt, then when you were saying about the studies of what damage we can do to people, I mean, if it's someone who's just coming in for a maintenance massage as such, and you're not really digging into any sort of, trying to figure out if there are any dysfunctions, or they're not wanting any corrective exercise or anything like that. So you're not looking to, you see some things on Instagram where, some therapists and whatnot are really, they're almost hitting people with like a hammer and chisel, trying to get that perfectly sort of straight pusher. And within a week or two, everything goes back to normal the way it was. And then they're calling them back around again, and they're kind of blaming them, saying, well, you should have kept up your exercises, without sort of saying to them, this is just how your body is, mate. It's the way it is. It's the way it's formed over the years through the repetition of your life and your chosen lifestyle and the exercises you do and this, that, and the other. And it's fine. Is it causing you any real discomfort or problem? And that's really, is it or isn't it? Is there an issue? Isn't there an issue? If it's just someone coming in just for a massage, just for a maintenance massage, just to feel good at the end of a week of working in the office, being crouched over at a table, looking at the phone, or, doing a bit of running, they just want just that touch of another person, and they're believing that you're getting, as we said, knots, or you're going to release some tension out of their muscles. I don't think you can do any damage. I don't think there's any damage done there.
So that's cool for level 3, and when I'm teaching like level 4, well, people aren't quite short to do level 4. I say to level 3 students, I'm quite jealous of you sometimes, because if your only goal in life is to make people feel better, then fantastic, do massage and work out the ambience, the music you're playing, choose the music the client likes, the lighting, the couch you're using. All of these little factors make that person feel as relaxed as possible. It's a beautiful life, and it can be really rewarding. Yeah. But I think there's a danger that a lot of people, I mean, in level 3, you're not even allowed to, in theory, work on injured tissue. But as soon as you have the goal to work on someone who's in pain and they've got an injury, then things have got to change, because then you are actually suddenly in the healthcare profession. Yeah. And that's when the danger, I think, and what the massage industry does, the fact we've got something called a sports massage therapy, we were talking about that last week, is a bit weird wording, because what it should be is once you start working with people who are injured, the massage should become less, the hands-on should become less, because that's when you need an understanding. Okay, I'm going to help this person get out of pain. Right, now I need to understand pain. But at the moment, you go to pretty much every single level 4, and all it is extra manual techniques and METs, trigger points, myofascial release. It's all about what else can you do with your hands. And the research shows pretty clearly now across, like Matt said, 10, 15 years, that the psychological aspect of someone's well-being plays a much more important part in pain rather than some anatomical thing. There's much more links to it. So I think the dangers in our profession of our level 4 is wrong. If you're going to
I think the level 4 is wrong.
You
speed through all this sort of like special tests and sort of assessment of somebody. It's just brushed over so fast, and you don't learn. It's almost like learning to drive. You learn to pass the test, and then then you're set free on the road, and that's when really you learn. And you're doing all the research yourself, like on YouTube, on sites like this and whatnot. And that's when you kind of get the rude awakening to shit. Like I've kind of been let loose here at this level 4, where I'm expected on. I believe, I've been told I believe I can work with injuries, and you feel actually a bit clueless, really, in the real world, and it's scary.
Are you cool with the level 4 then? Are you cool that you shouldn't be? If someone comes to you with a problem and pain issue and they're trying to get over it, then do you agree that we should avoid using words like release and not, because the literature shows that that could fuel their necessity for us and a third party fixing them? That just adds to the catastrophizing. And if they've come to us with a pain issue, that's what I think that's where the argument of do words matter comes from.
Yeah, but I think there's a commercial issue here as well, because there's so many people in pain. If we if as people are training up and they're below the pain educated level, if they got rid of all the clients who experience pain, they may feel they don't have it. And I'm not saying this is right. I'm just looking at why people take clients on, or why they command from education companies, I want more tests, I want more manual therapy techniques. They're ill-educated in actually what solves pain and problems until they've got to that level. So commercially, some education providers are clearly giving skills that maybe they should be enhancing the communication, the language, the consultation techniques, the motivational interviewing, behaviour change before pain resolution.
Well, yeah, I mean, the different level, I mean, okay, there's a few different threads I want to pull on here, because I'm just going to jump in and monologue for a minute, if I may. The first bit I want to pick up on is something you said, Matt, which is, when giving relaxing massage, you'd be concentrating on like the nice smells, the music, the environment, etc., etc. But when you start dealing with and you're making someone feel good with their massage, but well, see, when someone comes in with injury or pain, things change. Now, I'd first of all challenge that and say, why? Why does stuff have to change? Now, that might be me just being pedantic, but I think actually for someone who is in pain, being in a nice location with nice music, nice sound, and being made to feel good through manual techniques is actually more important. But that was just me picking up on something you said there, and particularly because of the link back to, we know that psychology is so important when it comes to pain. In terms of then this conflict between the different levels, excuse me, I mean, Becky, as you say, my better third, has pointed out that actually we need to have an understanding of what throwaway words can do, what harm throwaway words can do. So even when we think that the person, the conversation we're having is in not affecting the client at all, we don't know that for sure. So we do need to be mindful of it. And I think,
and that can change from client to client as well, depend on their personal circumstance and what's affected them in their life and history.
Isn't that everyday life?
Of it.
Yeah.
Isn't that with anybody?
Yeah. You have a conversation and you could be telling the best joke in the world to your mates, and then someone overhears it and you've insulted an entire population, group of people.
Paid for your professionalism.
Yeah.
Whilst you're being paid for your professionalism and you are representing yourself as involved in healthcare, then actually there is a level of professionalism we absolutely have to meet. And I think that's where there is an overlap. Traditionally level 3 is kind of like you say, that feel good spa massage. And then essentially the further you go through your levels, the further you go through your CP, what you're becoming is more clinical. And my interpretation currently of what it means to be more clinical is that you are shit hot on your red flags and you can clinically reason based on evidence-informed practice and probably the person in front of you, why you are doing what you're doing when it comes to the treatment you're applying. Now, what I think is missing from the level 3 is an understanding of what's going on during clinical reasoning. We don't expect clinical reasoning at level 3, but there is absolutely no reason why level 3 cannot work on someone with long-term chronic lower back pain if they've been clinically assessed to only have non-specific lower back pain, and it's not in fact cauda equina, or it's not in fact something else more sinister that needs looking at. There's actually realistically no reason why level 3 couldn't work on someone with pain. They just need to have it cleared, because they're not being expected to know the level of red flags and clinical reasoning that means we can confidently say actually a massage isn't going to cause any untold problems, or we're not delaying this individual in seeking further care. And so
a level 3 person needs to see 100 patients or 200 patients before they can start appreciating that. That's what I mean by level 3. You need a year to learn about people.
But you could argue here that this is where the education needs to change, and maybe a level 3 shouldn't get full insurance. They should be under a level 4 or 5 or a clinician on probation, a bit like physiotherapy training, for example. They come out, they go in the NHS for a period of time, so that the educate. And I know Gary's one of the best people to speak to about education and levels, some of the comments he's been putting in. But this might be where groups like STA, like us here, and what we're doing is discussing ideas about how education should change to help the level 3s work, earn money, be in practice, while being mentored by somebody who's higher qualified and can guide them through the language, the consultation, and so on and so forth. I don't know. What do you think?
I agree. I think there's probably a larger question here, which is not one necessary to answer, because, like you say, we don't have people like Gary here. But is level 3 fit for purpose? Level 4 or 5 fit for purpose, based on what we know currently, based on the types of courses available? Because essentially, you know, again, the very raw position I take in terms of manual therapies at the moment is to be a damn good manual therapist, you need to have critical thinking skills, clinical reasoning skills. You need to know your red flags like the back of your hand. And then how you actually touch someone is entirely independent on that person, because fundamentally the techniques are all doing the same thing.
Yeah.
And that is usually the bit that scares people, because they feel like they've gone and they've learned, you know, they've done a whole weekend of myofascial release work. They've done a whole weekend on trigger point work. Realistically, it's all doing the same thing, but it's how it's interpreted by the client. And that interpretation comes with words. It always does. You know, I don't know any therapist who's silent during treatment.
Dan Williams made a good point, and it's why is pain education not one of the first things taught at level 3? And I completely agree. Why is that? Because that's one of the fundamental things, really, that we need to understand.
But I think education is about 30 years out of date, even though it gets modernised.
It's crazy.
It's not developed to the physical person that we are today. 30 years ago, when I was teaching Group X, anybody got an injury? Nobody had an injury. And if someone did, everyone was concerned. It was like, now it's the norm to have an injury or an ailment or a modern condition of our lifestyle. And I'm not sure that education has caught up with that on a broader scope, which is why we're having this conversation.
I mean,
do we think in that sense that maybe then even, I mean, I'm touching a dangerous ground here, but do we think that maybe the medical system then we're over-labeling things? Are we over-labeling things? As you said there, like everyone's got something. So are we over-labeling things?
So I think that is a recognition.
I don't know.
A recognition within healthcare is diagnosis useful, and to what extent is diagnosis useful? To what extent is giving someone a label useful? You know, we call a lot of things syndromes. So piriformis syndrome, for example. Yeah. The reason it's a syndrome is because we don't really know what's going on. It's just hurting around your backside and you're getting a little bit of sciatic type pain. Anything with the word syndrome after it generally means we don't know. But we need to label people. Usually,
is it to give an answer?
Well, it's to give an answer, but it's also based on measurements. We have to measure people to know if we've made a difference. We have to measure groups of people to know whether, you know, the public health offerings shifted the needle in terms of better outcomes. And so there is almost a requirement for labeling. Now, as private practitioners, we have a lot more scope there as to whether we decide to label people or not. And that's the awesome aspects of being what we are. And, you know, let's not go down the regulation route, but the fact that we're not regulated means that actually as individuals, we have that autonomy, and that is amazing. So long as we understand the responsibility I think that comes with, and that responsibility being to educate ourselves and probably apply pressure on our educators to make sure that they're at, you know, the top of their game as well.
But everyone just wants it cheaper.
Gary wants to speak. I'm just seeing here, please. Can we all just have a moment's silence? Okay, this is important. Gary Benson says in the comments, people are listening, I so wish I could contribute to this conversation. Gary, the stage is yours.
Don't let him on. Don't let him on.
Whilst Gary is typing out his contribution to the conversation, I'm interested in how. So we're all talking about things need to change to various degrees and stuff, and I'm sitting here kind of nodding and shaking. But one of the interesting things that I'd like your ideas about is how do we get these ideas across to a therapist without making them feel threatened? Because a lot of the time it does feel like we're saying everything you've done has been a waste of time, and some of the language, and it's useful for me to sit back and just shut up because I can hear words that trigger me. Like I don't like it when I hear Matt say basically they all do the same thing. For me, that's obviously something you wouldn't say to any therapist, and I'm not even sure they are all doing the same thing, because they're not all doing the same thing. As soon as you start touching someone with different depth or sense or angle or the other side, or the way you're touching them, picking them up, prodding or poking, or all the different Swedish massage techniques, all stimulating in a different way. But all I'm doing is blabbing on because I want Gary to speak.
That's fine. What I'll do is I'll defend that comment quickly, because it is a gross generalization, and I am very adept at doing that. So when I say they're all doing the same thing, what I mean is fundamentally we're interacting with the client's nervous system.
Yeah, you make it sound like you can only interact with the nervous system in one way.
No, you can interact with the nervous system. Well, this comes back to words. Words are interacting with the nervous system. The environment, the smell, is interacting with the client's nervous system. So the different touch is interacting with the client's nervous system in different ways, but it's not doing anything other than that. So when I say it's all doing the same thing, what I mean is it's all interacting with the nervous system. At that level, they're all doing the same thing.
You can touch people in different ways and get very different reactions. Believe me, it's kind of...
But how's that touch interpreted by the individual? Through their nervous system.
Yeah, the conduit is the same, but I think it's dangerous saying that just because you're touching them, it's still just doing the nervous system. There's plenty of different ways to get a different reaction. You slap a kid around the head, they're going to have a different reaction than tickling them behind the earlobe, aren't you? It's kind of very different.
You've only interacted with the,
and I'm not condoning child hitting or anything, just for the podcast. Okay, just using an example from the 1980s.
But I think that comes back to the layers of comprehension, and what Matt's pointing out is there's a very simple hand to skin or skin to skin contact as a neural influence. Then there's the variables of pressure, speed, timing, body part, the language, the smells, the heat, the surface of the massage bed. Create the variables, and that is potentially is controllable by, partially at least, by the therapist, but also in part from the client. And so it's that interaction where the language is important in the consultation, the language is important in the education. I think the idea of listening more and speaking less is important, and almost that listening between the lines to know how to drip feed. A lot of the comments coming in is about Chris and Dan and Mike, about drip feeding information back to the client, and maybe saying less in the beginning until we get to know them, and then start to gradually introduce a vocabulary. Might be a simplistic way of starting to solve this problem for people, particularly people at level 3 just now. If they're feeling a bit confused, I'm just aware some of the people listening may be level 3, and it may be that it's worrying them a little bit. So that's a simple way of maybe considering it.
I must admit, and I know Gary's looks like he's finished chatting, so I'll keep this very brief. But the way I look at it, I know it can seem like we're throwing the baby and the bathwater and pretty much the rubber duck out all at the same time when it comes to therapy when we discuss like this. But I try and look at it the other way, which is actually we have almost more scope to work with people now that we understand a bit better what it is that we're doing. And don't get me wrong, what we're saying is not definitive. This is just the best evidence we've got at the moment. And it will continue to evolve, but it's more likely to become a bit more granular in our understanding rather than massive shifts. But I see it as actually being a very, very positive thing that we can touch people and that they can trust us to touch them, and that we can adjust the way we touch them to meet their needs in an environment that suits them, and the time that we can spend with them. And I think it is more powerful to be able to put that back onto the client and say, I will facilitate you by making you feel good, but you're the one doing the hard work here, as opposed to I am modifying your tissues and changing, you know, your physical makeup as a result. I genuinely think this is all really positive stuff.
Yeah, I mean, there's the whole idea of literally you touch somebody on the elbow if you want to sell them something. You know, the old car salesman idea and human contact. We know it's powerful. The skill of the therapist is understanding that power and then how to play the tune, so to speak, in pressure, speed and everything else. Absolutely. Can I just raise the point, because I'd like to go, it kind of just changes the conversation, the dialect a little bit, if that's all right. Matt, you talked about the idea of marketing, which I think is an interesting point that Gary mentioned in previous chats about the way we communicate what we do in our marketing versus what we do with the client in the class, in the therapy room. So I don't know if you wanted to say something on that, Matt.
Yeah, again, so I'll attribute this to Dan Williams, because again, it came from a conversation I was having with him, but it was a reflection on, okay, so obviously this conversation started when we were talking about the difference between layman's terms and technical speak and jargon and all that kind of stuff. But there is obviously a temptation when it comes to marketing to kind of put down what the client wants to hear, what you think is going to attract them. And we know that there are still a lot of courses out there that are teaching, I'm going to use the word debunked, and I know that is kind of a bit strong, but teaching concepts that the evidence has moved so far on from that are almost not relevant now, and frankly shouldn't be taught now, because it just muddies the waters when therapists then come across someone else saying, no, well, no, that's rubbish. Things like improved blood flow, things like flushing toxins, and things like releasing fascia. And then the question is, but if that's what the client is looking for,
yeah,
where does it become, I don't know, immoral, out of order to use that in your marketing? And are you preempting the conversation with the client because they've seen on your website that you flush toxins, and so they're coming in going, well, I feel crap, can you flush my toxins? I know no one does that, but as an example. Well,
you say that. I was doing some research. I've got some links to some websites that will teach you how to flush out the toxins and massage knots. But I think when it comes to marketing, the challenge is, and you're right, people want to get people through the door so they can practice, so they can advance, they can get more skilled. If they're not coming through the door, there's these sexy things they can say, like detox, flush out, whatever, you know, pain relief or whatever it is. And so there's that problem, isn't there, between getting the clients in to get the practice and actually setting up an appropriate, which is what I think you're talking about, Matt, an appropriate level of expectation, so when they come in, they're already they're either expecting to be flushed out or not. And so you're able to correct the language as you get, or have the right language right from the beginning.
Yeah, I mean, you need some of that terminology within your business scope as well to advertise it as. When people, you know, Google search engines work, so people will be Googling, looking and using those terminologies to try and find someone to help with that. And if you've got none of that terminology in there, because as you say, you know, it's debunked, then you're never going to come up on a Google search engine as well. So you kind of need that within the marketing as well.
Absolutely.
So it is hard.
It is hard, but I would suppose, again, to play devil's advocate, I don't necessarily have an answer to this, so this is pure devil's advocate, but whose fault is that if that's what the general public are searching for? Whose responsibility is it to communicate to the general public that, again, things have moved forward and the therapy world is moving forward with it, with any luck, and so actually your expectations need to shift along with what it is that we're delivering, because we're not static, and actually we should be proud of the fact we're not static. You know, it's the therapies that remain static that worry me.
I think we all need to collectively be responsible for presenting integrity in all of our marketing vocabulary. You know, doing this, I'm fully aware. I'm trying to be careful about what I am saying, because I'm aware of but there's a mixed audience out there that's going to watch this back, you know, all the people in here now. And I'm always trying to think of all the different perceptions that I might create with every word I choose to use. So marketing isn't a throwaway, I can fix this, but I think as a group, the fact we're all here now and anybody who's listening to this is a great thing. We need to be collectively responsible in how we present ourselves with integrity to set up the right expectation.
Yeah, I mean, this is a conversation, fun enough, we've had within the ISRN, which is obviously a different professional association.
I thought they'd collapsed.
I was going to say, yeah, mute.
Didn't TCT by then? I can't remember. I don't know.
But when it comes to the term soft tissue therapy, so, you know, the level 5 diploma in soft tissue therapy, you're qualified to be a soft tissue therapist. Well, clearly, what's a soft tissue therapist? It very much depends on the public perception of what a soft tissue therapist is. And certainly when the qualification was I'm going to say rebranded, that sounds terrible, but essentially retitled, no one had a bloody clue what a soft tissue therapist was. So you tended to find no one was searching for you. And so from a marketing perspective, if you didn't have sports and remedial massage therapist on there, no one would know what you were.
Sorry, Matt. No, I can't do that to Matt. I can't do that to Matt. Okay, look, well, it's 8:59 already, so that was a quick hour. I want to kind of sum up now, because we've had a chance, us four, to listen to each other. Is there anything which you've heard somebody else say? Because that's hopefully what people listening to the podcast as well are going to do. What have I heard tonight that's going to change what I'm going to do or the way I think? Is there anything you've heard anyone else say which has made you think, that's going to make me reflect a little bit? Anybody can answer that. I don't want to pick on one person. Or anything just in the general conversation which you thought, I need to consider that.
Yeah, I don't think it's anything. I mean, maybe not even on tonight. I just think, you know, all four of us have been chatting over the last, you know, few days and whatnot, and yeah, no, I completely agree in the sense of we do need to be re-educating people, the client, you know, our communities, to be able to get on board with the times, so that we as therapists can grow with the times as well, because we're kind of like stuck in this sort of sandwich, aren't we, where we're getting this education which is out of all, you know, it's no good anymore, but the rest of the world still lives around this. And so where then, you know, above, we're getting taught then newer things about, you know, that it's not right to say this, that, and the other. And you're kind of just stuck in between, because everybody else in the world is still eating this bottom layer of a sandwich. So how do we get that point across? And the only way to do so is for us as therapists to start using that in our vocabulary to normal people and make it those sort of layman terms. But, you know, that's a lot of sandwiches to eat, isn't it?
I mean, Rachel made a really cracking point earlier in that you know, where is the metaphorical dictionary that provides us the layman's terms for the technical terminology that we use, that we could perhaps all agree upon, and provide some consistency? Because I think what we're saying here is that we need consistency in our education. We need consistency then as therapists, and we need to get that consistency kind of consistent enough that actually the general public get it as well. But we do need, you know, maybe a bit of a language framework. I mean, there's some brilliant papers and studies that have looked at, or recommendations that have looked at how to rephrase things like wear and tear. It's actually just normal age-related changes. Why not come up with a bit of a glossary of terms that are common within manual therapy, that there's a bit of a consensus on, that we can start using a bit more? Because again, the more consistent we are as therapists, the more the general public are likely to pick up on it. Because I don't think we're ever going to have a full-on media campaign to tell the general public that,
get in touch with Apple.
Exactly, you're nuts. Your knots aren't knots. They're just sore points of unknown origin. I mean, it doesn't roll off the tongue. Yeah. But perhaps if we can start introducing some of that language. So that was my reflection.
I think my reflection, in which I think I've always been, prone to.
I'm laughing at Scott.
I know, I've just seen it. Is to critically analyse what I do, both as a practitioner and as a teacher. And when Matt messaged me and asked me if I'd be on this, just gave me Do Words Matter, and I went away and I've done a little bit of research, and I've now got a pile of CPD, which is helping me to self-reflect, to develop. And then what I will do is take this conversation. I've had some private chats with Ben as well, and develop that to then support both my clients and my learners as well. We've got to be open and honest. I feel responsible when we can influence people through these chats. I feel very responsible to say we're the same. We're all the same. There's no hierarchy. There may be levels, but as Gary says, let's get rid of those levels. But we need to be open and honest about how vulnerable we are each individually, even as influencers.
Absolutely.
Very nice.
Yeah, absolutely.
I think I don't know if it's worth bringing up Leanne Woolworth's, because that one tugs on the heartstrings, because I really do feel for you, Leanne. Making the point that it's frustrating to hear that a course perhaps you've done recently is outdated, and yet when you're looking at other courses, obviously there is then the advertising tactic of, well, this course is more modern. Well, what does that mean? You don't know what you don't know. So how can you tell what's being presented is more modern and is evidence-based? And it, to spin it from the perspective of an educator who markets courses, yeah, that's really tricky as well. How do we make sure that the likes of Mike Grice and Anna Maria at the school, how do they make sure that the content that they're providing and the way they provide it comes across as accurate and trustworthy, as opposed to merely just more noise? And there's a lot of noise in our industry. It is tricky. So I think I would hope that educators worth their salt are working as hard as possible to communicate things well, and comes down to doing a little bit of your own research as well, I think.
Yeah, Gary for president.
It's been really nice. I've sat back tonight listening to everybody, also just keeping an eye on the comments. And I think one of the things when we talk about a topic like this is just seeing all the different reactions. And it is like having any class as an educator, where you've got people in the class who've got different personalities and they switch off at different things, they learn differently. And for example, like Leanne's comment, there are people who feel that, the initial reaction is kind of like disappointment and maybe anger and confusion and frustration. And I think one of the challenges is, I'll stick by my guns and say that there is a lot wrong in our industry. It's outdated. In most courses I see out there, they're just encouraging people when they increase levels to look for something else to do with their hands. Let's stick pins in. Let's use little rubber pods to lift people's skin up. I'm not going to mince my words with that. There's an awful lot which is drawing us away from the brain and just concentrating more on the skin and the fascia and the structure, and let's make this person aligned. So, but as an and I'm sorry if I've offended anyone listening now, but what I'm also conscious of is we got to try and find a way, and this is really going out to educators, of giving as many doors as possible for these people to actually gently have a little poke inside and enjoy what they see. For me, it was comedy. I love comedy. We were talking about Greg Davis, and we were talking about that earlier on, having a laugh about Taskmaster. And I can't remember who it was. I think it was Rachel who said that Matt's a bit like Alex Horn of Anne-Marie and Becky. But for me, it was comedy. So for me, Lorimer Moseley, for example, was the door. When I looked at his videos on YouTube and I heard about his story of like stepping on the snake, and then years later stepping on something else and thinking it was a snake, and it was all done in comedy, but that just struck my brain and thought, oh my God, he's just explained to me in a joke something that's so significant. And then you learn about phantom limb pain or something with somebody who's suffering a pain in their toenail which hasn't been there for 10 years. So it's all about trying to find the little doors which allow people to progress and evolve gently, because it is an exciting thing. And I go what I said before, hats off to anybody who wants to help people in pain. It's a beautiful life and it can be really rewarding, and no one's trying to belittle what you've studied in the past, but we are, I say we, like when you find people who are presenting new information to you, it is also because we want to help therapists help others as well. But you're going to have to look around a little bit and find what tickles your fancy. It might be Paul Ingram, it might be Greg Lehman, it might not be either of those two. You might despise what they say. You know, you might like shouty Adam Meekins and think, oh, that's woken me up, but you might hate it. So with regards to Leanne's comment, have a little read around and find someone who you like the sound of, who doesn't make you feel threatened. Maybe go and see them live so you can meet them in person or something, and then work from that. If you find someone who ticks your boxes, then look at who they hang around with and open it out that way. It is exciting. I've never been more excited than before, you know, knowing what I know now and knowing that I know quite less than I thought. And it's a great thing, you know. So
I just want to jump in because actually it reflects, again, a conversation I had with a current student of ours earlier today. It's just popped into my head when you were mentioning those phenomenal thinkers in kind of the musculoskeletal world, because I'm not all sports therapists, there's physios in there as well. But another incredibly valuable place of information, particularly if what you're looking for is how do I work out what's being sold to me is credible, is go and speak to patient advocates themselves, the likes of Gilletta Belton, the likes of Keith Meldrum, because they're folks who have lived this. You know, they have tried everything and they know what works and they know what doesn't work, and they are so close to the pain research and looking at it from a patient advocate or a person living with pain advocate perspective, that actually that's probably a really valuable point to start at, to work out, okay, so what messaging actually should I be looking for? Because if the people who live with pain don't credit it, then it's probably not worth your time either.
Could be. That's good. Yeah, good advice.
Yeah.
All right, folks, it's 9:10. We will have to have a part 2, I suppose. We keep saying that. I've got 50 part 2s coming up soon, so look out for those. No, 49 part 2s. Right, well, guys, I really appreciate your time. I think it was good. We introduced a few different angles, and we're still talking to each other, which is nice, which is all about as well. Talking is the way to get educated, isn't it? So people, feel free to keep this conversation going. Chat about what you've heard. Challenge what you've heard. Don't be afraid to challenge anybody. That's important as well. Yeah, thanks for coming along. Just briefly, quickly, Rachel, have you got anything coming up in your fantastic professional life of helping others? What have you got going on?
Yeah, we're back to face-to-face. So, but we've still got this online portfolio that we've put together over the last year, so they can find that on biomechanics.education.com. Thank you.
Fantastic. There you go. And you're going to release soon a new CPD course for everything we talked about tonight, by the looks
language. I'm actually just doing Dr. Gary Mendoza's behaviour change and motivational interviewing, and it's brilliant. Got to say.
Fantastic. Yeah, so look out for that. Matt, what you got going on? Massage Collective have been interviewing for us. Bonnie Leonard, Bonnie. Got some surnames for now. Bonnie. Some great guests you've had. Still going strong.
So the Massage Matters podcast is cracking on. We'll be doing another live from Therapy Live, which is June the 11th. If you haven't got your ticket, your free ticket to Therapy Live, there'll be 100 sessions over the day, 10 rooms of 10 streams, and yeah, it's looking immense. I'm waiting until I'm allowed to talk about a very, very exciting chat that's been lined up for me. Wow. So stay tuned for that one. And obviously, back in the classroom. It's awesome to be back in the classroom.
Very nice. And Benjamin, can I call you Ben? I'll call you Ben, but I realised you might not go by Ben. Do you go by Ben?
Yeah, call me Ben. Yeah, I don't know. I keep it so formal on socials and stuff.
Everywhere it's Benjamin.
Everyone calls me. My friends call me Benno for some reason.
Benno, I like it.
It's like I'm from Australia or something, but yeah, it seems to have stuck. So I've just opened up a new clinic. So I used to have a clinic space in Chester City Centre, and now I've moved to my, Hellsby, the community I live in. We've got a brand new sports community centre that's opened up, and I managed to bag their back room there. So it's very exciting. I opened up this week. And then, just from talking to you guys as well, it sort of put me in a direction of where I wanted to start aiming my education and whatnot as well. I was looking at doing a level 5 course with St. Helens College. But now, after speaking to you, I didn't think it was fit for purpose. So I wanted to know more of an evidence-based clinical aspect of what we do. So I chose Mike Grice's course, and I just signed up to that. I'm teaming up and working with the wonderful Alistair Cunningham, his Liverpool branch. Thank you.
Fantastic. Good shout out there for Mike's course. No, it'll be exciting. I'm looking forward to following you. I think you've got lots of really useful stuff to say, and yeah, fresh face as well. Not to say that Rachel's not fresh and Matt's not fresh, but it's always nice to have somebody. I remember when Matt was fresh. I remember when Scarsbrook was like, "That's an interesting bloke. You had Matt Scarsbrook, yeah." And now he's just everywhere. So, but it's nice to get someone who's fresh, Ben. We're going to turn you. Yeah, it's going to be interesting. I think you've got a lot to say. I think you represent nicely people who are a bit wide, and the points you raise are really, really valid. I think it's useful for educators to hear people like yourself saying, "What about when Big Dave, the rugby player," and I can't remember the name of the person for the fish and chip shop, but it's really good. We need to hear more of that. So thank you for giving us all that.
12 months' time, Ben is going to sport a beard, sponsored by.
I've been there.
I know, but it's kind of
20 years ago.
It'll be a Massaging It Live podcast, won't it? It'll be something like that. Massaging It Large. Great. All right then. Oh, Tommy, you got
It's just for all inclusivity.
Say that again.
I said it's not to say you wouldn't look gorgeous in a beard.
I'll doctor that on the next promo.
Right. Thanks everyone for joining us. Sorry, I forgot we were still live. Thanks very much for joining us, everyone. This has been the first episode I've actually kind of made notes whilst people were talking and stuff, and people were writing comments. So I've got stuff to read through myself. But yeah, thanks for joining us, everyone. And like I say, spread the word. Obviously, one way to get this information out, if you guys have found this useful, is to spread it with people who don't know about us. Remember, it's not nothing about the STA. Believe Gary, is nothing about the STA's money making, but it is about trying to help as many people as we can. So really don't hold back on sharing this on social media, particularly with people who don't know about us or people you think it might help. That's one of the greatest ways to improve education, is just word of mouth from people who already trusted. So do us a favor and share it with someone if you can. That'd be great. We'll be back next week with Gerard Green, and it's going to be all about pelvic health. So that's going to be a really interesting session. 8 o'clock on the Sports Therapy Association Facebook page. But for now, from Rachel, Frances Thomson, and Ben Boy, Mace-Crossley, and Matt Scarsbrook of the Massage Matters podcast, we wish you good night and take care of each other. So long.
Bye.